All right, thank you for joining us today for the release of the RCRC Toolbox. We're really excited about this. It's the culmination of a lot of years worth of work, and really we hope to be a great tool for communities and parents and family members and organizations looking to help build the resilience of children in disasters. This project is part of the Resilient Children, Resilient Communities initiative, which is a partnership led by the National Center for Disaster Preparedness at Columbia University's Earth Institute and Save the Children, funded by a grant from GSK. My name is Jeff Slegemelch. I'm with the National Center for Disaster Preparedness, and I'm joined today by Jen Smith from Save the Children. So before we get into this, just a little bit of background. At the National Center for Disaster Preparedness, we're focused on really, in some cases, conducting the primary research out there in the field, but in every case, always making sure that we're applying the best available research to contemporary issues in policy and practice to have a real impact today on the way that we prepare for, respond to, and recover from disasters. And we've always had a special focus on the most vulnerable of populations, particularly children. Jen, do you want to talk a little bit about Save the Children?
Yeah, sure. So Save the Children works here in the United States and around the world to make sure that children have a healthy start, the opportunity to learn, and protection from harm. And as an international humanitarian agency, we've been working for almost 100 years to support the needs of children in emergencies around the world. Here in the United States, we've been working to help children and families in every major disaster since Hurricane Katrina. And we're really excited to apply all of our knowledge and experience from the field to this project and to this partnership.
All right, so going way back, the question of why focus on children, right? Disasters create so much stress across all aspects of our communities. Why to focus on children? And a lot of our research and the experience of Save the Children is that children are the bellwethers of a community's recovery. If you want to know how a community is doing after a disaster, look to the children. If they're doing well, the community's probably doing well. But if they're not, there's a whole range of different actors and resources and institutions that children rely on every day within a community. And if they're not functioning, it affects how the child is doing. Furthermore, children don't have the ability to advocate for themselves, especially younger children, the way that adults do, and so often aren't able to ensure that their needs are being met. And as a result, they're often left out of disaster planning. To put this in a little bit of context, we all know that disasters can occur anywhere. We know that on any given day, nearly 70 million children are not at home, right? They're at school, they're at after-school programs, childcare, they're where they are when they're not with us every day. That means that planning for disasters has to be done within the home as well as outside of the home. We know that more than half of Americans don't have an emergency plan, and some research that we've done as part of this initiative suggests that of those that do have a plan, a large proportion are lacking critical components. After Hurricane Katrina, it took 7 months to reunite the last child with their family. And children are as much as 5 times as likely to have serious emotional issues after a disaster than children who are not affected by a disaster. As part of this initiative, we did a national survey based on some surveys we had done in the past. And this is all available for free in the toolbox we're going to talk about, as well as the project site. And some of the things we found were, as we mentioned, preparedness among households remains low. Awareness of emergency plans for schools and childcare organizations, where our kids are when they're not with us, is also very low. We find that people place a lot of trust in communities, much more in community than in government as an abstract term. And we also learned that trust is low, but while trust is low, expectations are very high, and maybe inappropriately high, that we're expecting too much of external support to come too quickly in a disaster. That's just not realistic. So the Resilient Children and Resilient Communities initiative was built around this goal of finding a model for child-focused community resilience, something that's sustainable, that's replicable, that can work with maybe just some adjustments to existing resources and knowledge base. And there are 3 different components to this. We have the Community Resilience Coalitions, which we'll spend a bit more time talking about, are really the heart and soul of this initiative. And I want to say hello to our friends in Putnam County, New York, and Washington County, Arkansas, who are watching today on this. They've really done the work to really carry through a locally executed strategy of making our communities more resilient for children in disasters. Of course, we want to backstop this with good research, good evidence-based approaches, and contribute to the research wherever we can. And also, the work we do in communities works within an ecosystem that's set by national policies. So how do we make sure that the voices within our communities are working their way into that national dialogue? And so these two community resilience coalitions in Arkansas and New York State are really very dynamic partnerships of both public and private institutions with incredible champions from multiple sectors across the community, with stakeholders who identify and address these issues. They work in small teams and come together as larger coalitions. But instead of us talking more about it, we have a video here where you'll be able to see firsthand some of the great work that these communities are doing every day.
Children rely on so many adults. They rely on school, they rely on after-school care, childcare, camps, churches, family members.
So what do these programs have in place to recognize and meet the needs of children after a disaster?
We have to plan ahead for the unplannable. We have to really try to figure out who is going to be there in the first 24, 48 hours.
The Resilient Children, Resilient Communities Initiative is a partnership between the National Center for Disaster Preparedness at Columbia University's Earth Institute and Save the Children, funded by a grant from GSK to help communities better prepare for the needs of children in the event of disaster.
We have two community resilience coalitions, one in Putnam County, New York, and one in Washington County, Arkansas. They're really doing the hard work of bringing together child-serving institutions with the emergency management sector, with members of the community, and really ensuring that the unique needs of children are met.
We are working on coming up with a template that can serve as a scalable, replicable model, sustainable, for other agencies, other areas to use throughout the United States.
We've been working to bring together groups that are both where children are during the day or where they could end up during a disaster. We were able to test that through a tabletop that we had.
Collapsed freeway overpasses, collapsed buildings, widespread power outages, cable and VoIP phones.
To hear schools or child care providers say, well, if this happened, I'd call 911 and they'd be there.
911 stood up and said, you guys need to be ready to function on your own in a major disaster for about 72 hours.
All of those agencies we've worked with, we're connecting them to people that maybe they previously weren't connected to and didn't know were out there.
Joining the RCRC really made me realize how much more work we have to do and how much better we have to get at just making sure that we are ready for anything.
I understand now that we have to have communication amongst all of our different entities out here in the community.
If children can get back to normalcy, then the community gets back to normalcy. People can go back to work. They can begin rebuilding their lives.
Whether it's individuals who get excited by it and want to go make a change at their household level, that's a victory. When it's an institution that wants to improve their emergency plan because they realize that it's good, but it could be better, that's a victory. And when it comes to a community that says, preparedness is so important that we want to have a big community event about it. We want to talk about it on the news. We want to get people excited about it, that's a victory.
Really just incredible and inspiring work in both communities. It's such a privilege to work with both of them. And actually, if you have any questions throughout this webinar about the work being done in the communities and about the Toolbox, if you're watching it live, please submit them through the chat feature. I think you have to be logged in for it, but please submit them if you have them. We'll try to answer them live for you right here. If not, the contact information will be at the end of this, and we'll certainly love to keep the conversation going. So one of the things we really used to start this project with is the Community Preparedness Index. The Community Preparedness Index is a tool that was co-developed by Save the Children and our organization a few years ago. And it's an assessment. It's really an inventory of the kinds of regulations and policies and practices across the different sectors that we find are most critical for children within a community, groups like childcare and healthcare and emergency shelters, things like that. So we start the project with this, and it gives you a great opportunity to lay everything out on the table and assign it a score and find out which sectors need more work than others. And then from there, you've got some data to help inform how to set your strategy. Now, just because something is a lower score doesn't necessarily mean that that's where you want to start. You want to start where you have the resources together there to have the most impact right away, and Jen will talk more about that in a little bit. We're also doing this again as we near the end of the 3 years of this project to really, one, look at the growth, look at how much better there is and to be able to quantify that, and also to provide what's next for the communities. What are the other areas to focus on to continue, which sectors and what kinds of work should be for the next 3 years. In addition to this, I mentioned the national policy advocacy. We've assembled a National Children's Resilience Leadership Board with a cross-sector of representatives from the private sector, academia, nonprofits, as well as former government officials. And they've really helped us bring together a strategy, one, to help support the work of the communities through the expertise that they bring to the table, but also a network of actors and their different sectors to really help spread the word about this and help elevate the work going on in the communities to make sure that it's part of the national dialogue. I should mention too that just about a month and a half ago, we did a congressional briefing. We met with the offices of the congressional delegations, a couple of federal agencies, a wide range of national actors who really set policy for preparedness and resilience and how it impacts children across the United States, and really just had such an incredible reception and great conversations, giving the communities a platform to share what works for them, where they've found success, and what national level resources and policies would really be helpful in furthering that. And over the last 3 years, it's really, really great to look back and look at what have we accomplished. And I think locally there's this improvement in resilience, in coordination and preparedness of child-serving institutions, this cross-sector process that was really embedded into the existing structures to make it sustainable and to demonstrate that readiness through exercises and assessments. And nationally, to be sharing that model with all of you, to increase the awareness and help amplify this important issue, and to have those discussions and to have that influence on national policy leadership, to have those local perspectives, really a much larger part of those conversations. Bringing it all together, so over the 3 years, this is a rough picture of what it looks like, and I think that it's important to note that these 3 things all happen in parallel with each other, that having this conversation nationally is in tandem with building that local capacity, and really from day one, validating, evaluating it, providing numbers, providing information to really validate what we're doing, and also demonstrate what we should keep doing, what we should keep replicating with all of this. I also want to note that this project was always on a 3-year timeline, and I think it's really important to note this is not fast work. This is not easy work. Building coalitions, we work with incredible partners who have been dedicated from day one, and but there are a lot of different actors within a community with a lot of different things on their plate, and so to do this work, it needs the time to build coalitions, to build relationships, to work on those plans internally, and even 3 years flew by very, very quickly. But I think that that's the other piece to this, is that, I know a lot of times we work on fiscal cycles in 1 year at a time, but to really think about how this plays out over multiple years, because that's how this work gets done. And so just a little bit in terms of the logic model for how this works is that with this project, the inputs we're providing into it from national organizations are, expertise, direct support, evidence-based tools and models, some funding, objective evaluation and improvement, but this is really going into for community-based, for local execution of these strategies to determine what to do. And we're really working for them to help them come up with those solutions. Some of the outputs that they've done in establishing these coalitions, doing these assessments and these exercises, developing plans that you'll see some of those outputs today very shortly, and broad communication of these, and really ultimately for those outcomes of improving this community-based capacity to meet the needs of children in disasters and contributing to the long run of moving the needle on this nationally and really ensuring that after a disaster, all of our children continue to be on a trajectory to thrive. So the toolbox that we've been alluding to this whole time now is really the resources that have either been developed or curated through the Community Resilience Coalition development process. It's a dynamic set of tools that are focused on really helping to build community resilience, and we have 4 different portals for entering that too, which I'll show you momentarily. And I also want to stress that this is an initial set of tools, that the work is still continuing. We have more templates, we're working on some planning projects and some exercises, so this is going to continue to grow. And we encourage you to take advantage of what's here and to continue to check back. Because as this work grows, so too will the resources and the lessons that we have to share with all of this. What we're going to do now is I'm going to very quickly show you a couple of aspects of the toolbox. Then I'll hand it over to Jen to talk a little bit more about the model for building these community resilience coalitions. Then we'll come back to the toolbox with a few more specific examples. So you'll see with the toolbox, you go to rcrctoolbox.org, and this is your opening page. And so what we've done here is we've really taken the tools and we've categorized them into these 4 different categories. Child-serving organizations. This is a school, a child care facility, an after-school program. This is a kind of organization that serves children. If you go in the building and there's children running around, this is where you want to go. The second one is these community emergency planners. They have a little bit wider of a scope across the community. This is your emergency management agencies, some of your non-government organizations like the Red Cross, as well as departments of health, groups like that, groups that are responsible for planning across the community. That includes these child-serving institutions. You're a parent, you're a caregiver, individuals and families. There are tools in here, checklists, things like that. What are specific things you can do to get involved, both your planning within your home as well as beyond your home. And finally, policymakers. We have some video testimonials, we have some information, some of the studies and things like that, that if you're looking at what makes good policy to help set the stage for increasing the resilience of children before, during, and after a disaster, this is where you want to start. So you click on one of these portals here, and it takes you into the list of tools that we have. And so we'll come into this a little bit more and look at some specific tools. But you have here, you can simply browse through the different tools that we have. We have different types. We have guides, trainings, videos, things like that. If you have an idea of what you're looking for, you can enter it in the search box here. And we also have a couple of different tags. You can filter by category. As I mentioned, all the different types, videos, templates, webinars, reports, what is it that you're looking for, and an additional layer of tags if you're looking for something more specific. I'm going to come back to this very quickly, and I'm just going to give you an example of a tool that we developed as a result of this initiative. So there are sort of two major buckets of tools, those that we developed under this project and those that we used or found to be useful as part of this project. So for the ones that we have actually developed as a result of this, so for example here, a tabletop exercise template. You're going to see here, you'll see a description of it here, and you see 2 options to download. And I want to point out that one of these is in a Word format, which means you can download this and you can edit it. Even better, you can steal from it. You can copy and paste stuff from it, put it into your own template. Anything that we've developed under this project is yours to do with as you please. In this case, it's an exercise. I'll talk a little bit more about that in a little bit. But you can use it as is and enter in your information, or you can just glean from it the stuff that's going to be helpful to you. Other tools that we found very useful for this, but either predated this project or came from an external organization, we provide a link to that. So you can link to that and you can download it in its original format. And so because we don't own that, whether that's editable or not is up to the originating organization. So there's a quick peek at the toolbox and the different kinds of resources we have. We're going to switch back to the presentation now, and Jen is going to walk us through building these community resilience coalitions and what are some of the 5 steps for doing that. And then we'll come back to the toolbox again on how that can be used as part of your coalition building process.
Great, thanks, Jeff.
There we go.
All right, so I'm just going to talk you guys through some basic steps on what you might need to do to get started to make your own community resilience coalition. So step 1, find yourself a starting point. And if you can help it, don't start from scratch. We know it's a lot of work to start up any new group or new organization from nothing at all. So think about what's already going on in your community. Are there groups or coalitions already meeting about children or about emergencies that you can suggest this as an add-on topic to create another committee related to the specifics of children and emergencies? If there's not an existing group already, maybe there's an organization or agency that either has a great interest in this or a reputation for being a great convener and collaborator within your community that would be a natural fit for kicking this off really within your community. And if you can't find that either, then maybe there's just an individual. You know, every community has those people who those individuals who are charismatic, trusted leaders who can bring people together at the drop of a hat. So find someone or an agency or an existing group to be your anchor and your starting point for this sort of work. Step 2 is really about defining your vision and objectives. So figuring out how to work with the people that you've gathered in the room to build out that collective vision of what your community's ideal state looks like for protecting children in disasters. And to start that off, you might need to share some basic knowledge and information with folks in the room about what some of the common gaps are related to protecting children in disasters, and then to think through what the existing strengths and challenges are in your own community to set the picture there. What are the biggest gaps and concerns that you think you might want to focus on? And from there, what's that ideal vision that you want to work towards as a community? And once you have that vision, thinking about what sorts of objectives will help you get there and making sure that those objectives are SMART, those specific, measurable, achievable, realistic, time-bound objectives. So what can you realistically do with the people in the room, with your resources to work towards that vision? Step number 3 is figuring out who and what you need to really achieve all of those objectives. So you've got your starting group with people that you've managed to bring to the table in those early days. Figure out who's here, what strengths they bring to the table, but who else is missing? Who else do you need there with you to help achieve some of those individual objectives that you've set out? Who else might be interested in being part of the conversation, might be interested in this topic, and how can you get them to the table? And in the meantime, what objectives can you focus on with the people that you have? I know in both of our coalitions, we've had new people coming to the table at almost every meeting. It's been really exciting to see this grow and grow over the years. So we've had a core group who have been there from the beginning, but at every meeting, depending on the agenda items and who's hearing about the great work that's getting done, more and more people come to the table. Step 4 is about getting specific, creating that action plan. So figuring out what are those nitty-gritty steps that you need to take to actually achieve those objectives. How do you break it down into bite-sized actions, into projects, into committees? What's the best way to tackle this so that everyone knows exactly what you're working towards? And in creating that action plan, think about what are those things that are easier to achieve? What's that low-hanging fruit that you can accomplish early on so that everyone has a taste of success, that don't require so much effort? Because we know that a lot of things can pile up once you're making your action plan. I'm sure you're going to have great big ambitions and it might get to feeling overwhelming. So the idea is to really break it down into bite-sized achievable pieces here. And thinking about leadership for some of those different objective areas and some of those specific projects and actions. Who are the local individuals or agencies who are best fit to lead each of these project streams so that you can break it up and make sure that there's that ownership and accountability at the local level. And figuring out what level of detail is useful for folks and how you're going to hold one another accountable is something that should be discussed on an ongoing basis as part of this coalition work. And finally, step 5, don't forget to celebrate success along the way and to capitalize on that success. So figuring out throughout the course of the project, which events where you're raising awareness at the community level, which schools are improving their emergency plans, just finding ways to take time to reflect on and celebrate each success that the coalition makes, because we know that preparedness is an ongoing project and it can at times feel overwhelming. So we want to keep the momentum going, keep people excited and motivated and plugged in, make sure that everybody understands their role and the value they have to add, and to continue that momentum to keep the great work up. And so this is just a little outline of those 5 steps there, with an arrow to indicate that as you go along the way and as you get new people coming to the table at different points, you might want to revisit your objectives and figure out, are there new objectives that you want to achieve? Were some of the original ones that you set out maybe not as realistic as you thought, and you might want to revisit those. So it's an ongoing process to think about and redefine those objectives as you go, figure out again who else needs to come to the table to do those, and to repeat the process. And with that, we've got a couple of examples here specific to our pilot communities. So along those lines of creating a vision statement, we have a sample statement here from one of our communities about the Community Resilience Coalition envisions a resilient community in which all our children are able to quickly recover from an emergency or disaster with the support of the organizations and institutions that serve them. So this really shows us how in these coalitions we're focused not so much at the individual child level, but at those agencies and organizations and schools and programs that support children every day, building up their preparedness and their resilience. And one of the most interesting things to me about working with our two unique pilot communities was that through discussion in early days in both communities, both of our counties actually landed on really similar, almost identical focus areas. And we're going to take a little bit of time to think about those focus areas that our pilot communities chose to prioritize and share some examples within the toolbox about how your community might tackle some similar issues. So the first area was really around that resilience and preparedness of child-serving institutions. So like Jeff was talking about before, the areas that we focus on with the Community Preparedness Index, those places where kids are every day and where they might end up in a disaster. So the schools, the childcare programs, the after-school programs, foster care, hospitals and emergency shelters following a disaster. So thinking about what do those places need to have strong plans and to have a resilient atmosphere for children. And we're going to take a look at the toolbox now to see what we might be able to find there. So if we go into, we start with our child-serving organizations here. And say we are looking to start things off for training. If you're a leader in your sector and you want to understand a little bit more about what some of the potential issues might be or some of the resources that are available, we have a few trainings here to help you think about the basics of helping children and caregivers cope with disasters. You'll see here we have some great best practices and planning tips from Save the Children geared at child-serving institutions. So what are the things you should be considering and putting into your emergency plans? And here we have some information about our prep rally, Save the Children's Prep Rally, which teaches children the basics of preparedness through a play-based curriculum. So those are all sorts of great resources and trainings that folks can use in child-serving institutions.
Now, we all know that in creating community resilience, it's really the aggregate of all of these different institutions, right, that serve children every day coming together to ensure that the unique needs of children in disasters are met. But then there's an emergency management agency or a community-wide organization, right? There's a perspective across all these different sectors on how to bring them together. So we're going to go here under our community emergency planners. And what we're going to look at here, let's say you're doing an exercise. You have a lot of folks have a mandate to do an exercise every year. And you're thinking, we've been doing a lot of work around this. We've been doing some of the trainings that Jen just showed us. We've been building some plans for these child-serving institutions. We really want to look now at testing this community-wide with a discussion-based exercise, with a tabletop. Where should I start? Well, we've got a tool for that. What we have here, we developed and conducted exercises in both communities in strong partnership with them, focused on this very issue. And so what we've done here is we've given you those materials with the county-specific information taken out. And so and these are all done, I should say, they're HCEP compliant. That's the Homeland Security Exercise and Evaluation Program. These templates in this process, these were all developed according to that process. So if you're receiving federal funds or Homeland Security funds to do an exercise, these tools are designed to be compliant with that process. And so here you have the player handbook, a template for that for the players. You have the facilitator and evaluator handbook with the exercise evaluation guides and the scenario questions and things like that. You have the exercise scenario, the PowerPoint that you would show to the players to prompt the discussion, as well as the briefing that you would have before the exercise. You've got a complete toolkit here for that tabletop exercise. In the coming months, we're actually working on an annex to the county emergency management plans that we'll be able to provide a template for. So you'll have the plan to go along with the testing of it in the tabletop, as well as a functional exercise with some full-scale elements that we just conducted in Washington County, Arkansas. So we're in the process of taking that operations-based exercise and similarly being able to provide you those tools here in the toolkit. So a lot to get started with. And as you get through this, there's a lot more tools coming into this for that community-wide perspective.
And a third priority area from our two pilot communities was really about raising public awareness. We know that there's this focus on helping the schools and the programs that serve kids to think about their emergency plans when those kids aren't in the care of their parents. But the coalitions also wanted to make sure that families and children themselves understood the importance of planning and preparing for emergencies and focusing specifically on children's needs as well. And the way that our communities went about that was through a variety of public awareness events. They made relationships with local newspapers, and they held prep rally events, and they had tables at existing community events. In Arkansas, they managed to make connections with their local baseball team and their universities, and to really build on momentum and partnerships to help get the word out there and to help families understand the importance of making their own emergency plans, which include children. And on the toolbox, if we go into the individuals and families section here, we see some great resources that our communities used and that your community can also use. So if we go in here in the individuals and look, for example, for checklists, we'll find a variety of resources that parents can use as a starting point. So the first one we have here is for families who might be concerned about what the plans are at the places that look after their children when they're at work. So what can you ask your child care providers about emergencies to make sure that their plans are up to speed and that you know all the things that you should know about what your role is in helping to make sure that they can keep your children safe when they're in your care. And there's a disaster checklist for parents as well, which talks through the basic steps of how you can make your own family plan and talk to your children about what they need to know as well.
And then one of the other areas has really been on the mental health and how do we help build the mental health capacity and psychosocial support of children. And so there are various initiatives going on in the two community resilience coalitions focused on this and specifically on bringing things like psychological first aid training, things like that. But I think in addition to that, there are also a number of resources that we have available for you here. Tips for helping children after a disaster or traumatic event. Common stress reactions experienced by children after a disaster. And you're going to see we've actually categorized these in a couple of different portals. Because one, this is really useful information for individuals and families of what to expect. These are good resources for child-serving institutions to either bring into their own education as well as to provide to parents and provide to other folks looking to do this. And again, it's all a good evidence-based information. In some cases, we're providing you resources from outside of the initiative that we found useful and others that we developed and tailor-made specifically for this initiative. But it's all good stuff here for you. And so with that, I think this is really just the tip of the iceberg with the toolbox and the kinds of tools that we have available for you. I encourage you to go in there and look around, identify what other tools and resources are in there that might be useful. If you have something that might be useful, contact us. We'll put it in there. And as well as stay tuned for, as we continue to work in the communities and develop more and more tools as they bring together more examples, we'll add them to this. And so stay tuned for additional updates and things like that. So at this point, again, we'd like to encourage you, if you have any questions for us on the live webinar, go ahead and put those questions in the chat function where you're viewing this right now. If you don't have that function, you probably need to log in. And if you're watching a recording of this later on, send us an email. Go to the Contact Us section on the Toolbox, and let's keep the conversation going on all of this. So, Jen, along these lines, as we wait for some questions to come in, I think we've had, it's been inspiring, the level of success that we've had with the community members, and really a testament to strong leadership, strong champions, strong institutions in both communities. But with all of the success, certainly there were challenges.
Never.
Right? What are some examples of those kinds of challenges that communities can face and should really expect to face along the way?
I think to continue along the lines of what you were talking about earlier in terms of us having this 3-year window, to remember that this takes time. It takes time, it takes having the right people at the table, and it takes having it up there as a priority amongst competing priorities that all these agencies are having. We know it's pretty easy to bring everyone to the table initially to talk about keeping children safe in emergencies. I think it's a topic that people can quickly become excited about and feel like they want to be part of. But to sustain that excitement and to sustain the membership of coalitions amongst competing priorities that just happen day to day in everybody's busy lives can be a challenge. And so figuring out really along the way, how do we make sure that everyone there is connected to a specific work stream, that they have their name next to some of those actions and feel like they're really part of the solution, is something that is important to keep in mind, to make sure that everybody understands how they contribute to things and they're not just showing up to meet or showing up because their boss told them to show up. So we know there's a lot of interest and excitement around this topic, but naturally amongst competing priorities, people have to pick and choose sometimes, or there might be changes in leadership. And so, I just encourage communities to stay flexible and open and keep inviting new people to the table, and just keep track of that vision and those objectives that you build out together.
And, I think it's an important point too that, so often when we talk with other communities that are looking to do similar work, or federal agencies that are looking to provide more support, there's there's a strong desire for a blueprint, a recipe, a prescription for how to do this. What do I do first? What should our vision be first? And I think the reality is that every community, we all share in this common goal of having an environment where our children can thrive, and that is resilient to disasters. But what's most important, who you have the right constellation of partners to get started with, and what is that vision in the vernacular, in the language of the community and the priorities of the community, is much more of a moving target and really needs to come from the community. I think one of the things we have here is a great set of resources. So as you come up with that vision, you have a starting point, you have some resources to get started, but it really does require coming up with that from the community. Is that fair to say? Yeah, absolutely. I think all this needs to be community driven and things that people are excited about and want to put their time behind. Yeah. So, another question I think worth addressing is that, unfortunately, 2017 was a really bad year for disasters. Hurricanes, wildfires, earthquakes, just to name a few. And there's a lot of communities in the United States and in the territories that are still recovering from a disaster and now preparing for the next hurricane season. So this preparedness work, I know it was really inspired by a lot of recovery work our organizations have done in the past. Is there a place for this in the recovery process? Is there value? Like, how could recovering communities get value from this work? What are your thoughts on that? I think absolutely, and I think actually implementing this sort of work in a recovery setting actually removes that barrier of it being a priority or not enough people being available to be engaged, because it's top of mind for everyone. And when the communities are recovering, they're aware of all the challenges that are faced by their children, by the agencies that support their children. And I think you might find that a lot of these conversations happen a lot more quickly, actually, in a recovery context when it's fresh. And I know certainly in some of the communities that I've been visiting over the last year and talking about this work with some of our communities in the process of recovery, they're really interested in what's going on in Putnam County and in Washington, and they're excited to get access to this toolbox and to hear about the learnings and what people are thinking about in times of preparedness. And they're also interested in sharing their learnings in recovery back with our communities who are thinking about it in times of preparedness. So I think it's relevant across the disaster cycle for sure. Absolutely. And again, all these resources are out there for free for download. Just log in and grab them. And I think anywhere where they can find value, and certainly, you have great models in Putnam County and Washington County in the preparedness phase, but so much potential really across the country. Another piece that was a focus of this, we spent a little bit of time talking about, was advocacy. And I mentioned our congressional briefing in DC and connecting with the congressional offices. I was really floored by how warm the reception was for these conversations. I think there's a distance between Washington, D.C., between the federal agencies and the local agencies. Sometimes that's geographic, sometimes it's institutional, and we had great partners on both sides of that, both locally and federally, who were very, very interested and grateful for the local perspective being brought to Washington and hosting these meetings and hosting these conversations to learn more about what works to really help inform that. It was very, I think, positive look at it. And I should mention, one of the things we have in the toolkit is an advocacy guide, is some resources and some tips if your community coalition, you want to go and talk to your congressional delegation or talk to an agency about what matters most, what's most helpful for this, some best practices, some tips for what to expect in the meeting and how to organize yourself for that. And it really comes down to, if we can't have community preparedness without individual preparedness, and we can't have national preparedness without individual and community preparedness. We really need this growing at all different levels. And I think this project has really shown a very grassroots way of finding that model for doing this with the support of national organizations, and really just a beautiful reception from our federal partners and congressional representatives, among many, many others. So with that, I think we're going to conclude the webinar at this point. But again, just because we're stopping the webinar doesn't mean we're stopping the conversation. We've still got some work we're continuing on with our coalitions. And you know, this has always been intended to be much bigger than the work that we're doing. How can we make it easier for communities across the country looking to do this kind of work with the resources that came from 2 pilot communities really leading the way on this and providing some great resources. So we'd encourage you to check out the project homepage as well as the project toolbox, as well as to keep the conversation going by email. We're on Twitter, on other social media, Facebook, LinkedIn, groups like that, both our center and Save the Children. And finally, a big thank you to our partners at GSK. I think it really, the ability to look at a project over 3 years, the ability to have the flexibility to do advocacy and think outside the box and really complement the work that's being done through the existing emergency management funds, but to really do things that would not otherwise be possible, I think really comes from the support and the vision that GSK has really cultivated as a result of this. So a special thank you to all of you as well. So with that, thank you to all of you who joined us today or who are watching this on a recording afterwards. We appreciate this and keep doing the good work that you're doing.
Thank you.
Thank you.